As you know, for the whole month, we're focusing on frequent urination and its correlation with sexual dysfunction. And this week, the spotlight is on prostatitis. Exactly what is prostatitis? The name suggests prostatitis, inflammation of the prostate. And how does that occur? In fact, there are three separate types of prostatitis. One type is called acute prostatitis. Acute prostatitis is when there's an abscess or acute inflammation in the prostate will cause you to have pain, blood, the temperature, and also constant desire to void, and sometimes in bleeding as well. And this acute onset is not very common, and therefore it doesn't really present with problem of sexual dysfunction. The second type is chronic inflammation. The chronic inflammations can be caused by bacterial chronic inflammation or non-bacterial chronic inflammations. The bacterial infections is caused by E. coli. The non-bacterial inflammations sometimes can be a biopsy diagnosis, or sometimes is that the patient has got these problems but the bacteria is simply not cultured from the urine or from the semen. So what causes all these? In fact, nobody knows what causes chronic prostatitis, but it's awfully common. It constitutes about 7% of consultation with specialists such as urologists and about 1% of all GP consultations. So the symptoms include frequent urination and also urgency and the nighttime urination, plus also slowness of urination, intermittency, dribbling, and pain. And a lot of men also experience pain in the suprapubic area, in the perineum. Perineum is the area between the anus and the scrotum, and also pain on ejaculation. In general, prostatitis doesn't cause erectile dysfunction. However, because of the pain on ejaculation or sometimes blood on ejaculation, that itself will cause anxiety and causes the actual problems of erectile dysfunction. On some occasions, the actual problems with the symptoms of chronic prostatitis may also reduce and dampen sex drive and subsequently causes problems with libido. So what's the treatment? In fact, the treatment is healthier lifestyle. If someone is well hydrated and then completely avoid problems with alcohol or caffeines, and these will reduce irritation to the prostate. And with less irritation to the prostate, most men will get resolutions of this problem. However, when the problem recurs, there are multiple medications that can help, such as alpha blockers, non-steroidal anti-inflammatory, beta-3 agonists, and also 5-alpha reductase inhibitors. And these are all the medication can potentially help to suppress the symptom and hopefully restore the sexual function. For the last installation for the month of July, we're going to talk about something called chronic pelvic pain syndrome or interstitial cystitis. Obviously, you need to stay tuned for putting Dr. G on the spot.